I noticed some numbness and tingling using, putting my hands in certain positions. Occasionally woken up at night with what seemed to be just solid asleep limbs on either side. And just took it as, results of the physical work that I was actually doing. I had been over to Dartmouth to see the orthopedic department regarding my knee and hip pain. And they referred me to the rheumatology department because of the arthritis. And that led to further exploration to determining at that time, moderate carpal tunnel. So a few years previous, determining that the carpal tunnel was an existing situation. I was diagnosed with moderate, and then over a few years, I guess, to where the pain got to the point where I wanted to have the surgery. The carpal tunnel pain started off mostly as just kind of like being asleep and total numbness, tingling situation, increasing to more direct pain in my palms and through my fingers, sometimes up the arms. The pain, the constriction or contraction of what occurs once the body gets at rest, basically, was waking me up at night. A lot of numbness and hand pain that I just couldn't shake, which normally or previously I was able to get up, move around, get a little circulation going, and it would go away. But most recently, that wasn't the case. My surgeon was Dr. Warhold, and I guess he's pretty active in this new procedure and traveling around the country doing the training as well for other institutions to utilize his expertise. Dr. Warhold explained his procedure as a fairly new and innovative process to where they use a minimally invasive procedure to open up the tunnel and release the constricted nerves and vessels. The surgical center was very impressive as far as the folks that were there all seemed to be very upbeat and very focused on their jobs, and everyone was very personable and mostly concerned about my well-being in the situation. I had both of the release processes done within 2 weeks of each other. The recovery time was pretty much right on track for the way they explained it to me. There was a fair amount of pain for a few days. I had a little bit of swelling, but no infection, no redness, or no unordinary discomfort. Everything was pretty cut and dry. What they said was going to happen happened. Actually going back today to get the stitches out of my left hand. I had a couple of very nice phone follow-ups by the nursing staff afterwards, just to make sure the next day and a couple days later that things were progressing along as expected. I do feel a little more stability in my grip, and I haven't been waking up at night in the past number of weeks, so as far as I'm concerned, it's going pretty well so far. This technology has come a long way since my first diagnosis for what they possibly in 2005, how they would have approached it as how they approach it now. Much less invasive surgery to do the same type of repair.